So, chest and lungs inspection, palpation, percussion, auscultation. So, be ready with your stethoscope. Sa stethoscope lang naman ginagamit natin for the chest and lungs. So, always remember that you have to check both anterior and posterior chest. When you are starting with the examination, as whether for all systems, you always start on the right side. Kasi yun ang normal position pagka nag-examine. So for the chest and lungs, okay, so we do first your inspection, okay? Okay, for the inspection, chest is brown in color, skin is brown in color, tapos with occasional hyperpigmented areas on the anterior chest and posterior chest. Tapos good muscle development with sparse hair on the sternal area. Okay, then so no lesions, no scars. Then you check for the anterior and posterior diameter and the shape of the chest. So at saka pala you describe if there's any subcutaneous vessels. So no superficial blood vessels. Okay. Okay, Then you describe so tapos na tayo sa skin, sa muscles, no bony deformities, no? The chest, there is the AP diameter is normal, no? 2:1. Okay. No barrel chest, no pigeon chest. So, bony deformities yun, di ba? So, pwede mo i-report yun. Tapos, after that, you check the intercostal spaces, if there's any widening, any narrowing, is there bulging, is there retraction. So, sabihin natin na there are no intercostal retractions, no bulging, no widening of intercostal spaces, no narrowing of intercostal spaces. Then we also check for the rate and rhythm of breathing. So normal rate, regular rhythm. Pagka so tanong nyo na lang doon sa preceptor kung gusto nyo pabilang yung rate. Kung hindi naman, you just mention that the patient has a regular pattern of breathing. Then also the chest wall is, the chest expansion is symmetrical, no lagging. Ayun na. That's for inspection. So just make sure na you have time na tumingin kayo dito sa likod. Kasi you are observing also the posterior chest. So ganyan kayo, magtingin for inspection, tinitignan nyo yan. Tapos tumitingin kayo dito for a few seconds and then you give your report for inspection. Okay, then we go to your palpation. So palpation, we first check for if there's any pain. So no tenderness, no palpable lesions, no palpable masses. Kaya medyo kuminsan merong ginagawa nila. Medyo aside from palpation, aside from pressing for tenderness, you are also trying to palpate if there's any masses. Palpable lesions, palpable masses. Wala naman. Then after that, you go to your chest expansion. So, hingang malalim. So, kailangan itong thumbs nyo magkatapat. Kasi yan yung makikita nyo kung merong lagging, unequal yung movement niya. Sige, hingang malalim. So, kailangan pantayan. Yan, Then go to the back. Forward tayo. Ganun rin. Hingang malalim. Okay. So, kailangan pantayan. Okay, next you go to your vocal tactile fremitus. So, tactile fremitus, you start at the apex. You will ask the patient to say tres tres. Tres tres. Tres tres.
Stress.
So medyo didiinan nyo para ma-feel nyo yung vibration. Ha?
Stress.
Okay, ha? So dito nyo feel yan. Ha? Now for the back, posterior chest, forward. Pwedeng ito, pwedeng gusto nyo naman pag ganun, pwede rin. Sige. Kasabay na yan. Ha? So dito, you do it in the middle of the in the interscapular space. Ha? Hindi dito kasi pag dito may bone dyan eh. Hindi mo ma-feel yung vibration, so it has to be here. Pwedeng nakaganon para naka-widen yung ano. So pwedeng i-cross yung kamay, yan, para naka-wide, naka-displace yung scapula. Then you do your tres. Ako personally mas na-feel ko dito kaysa dito. Iba yung vibration pag nandito sa ano eh. Kasi si Dr. Ali ang feel naman niya, mas gusto niya dito. Lalo na pagdating dito. Ha?
Si
Pero
Dr. Ali yung preceptor.
ako mas gusto ko ganun. Actually, kanya-kanya style naman yan as long as you can feel the vibration. Ha? So when you report it, so negative tenderness, symmetrical and expansion, no lagging, equal tactile tremulous. Tapos na. Ha? Then we go to your percussion. So for your percussion, you do it in the mid-clavicular area. Ha? So start at the area. Ako ang ano ko is from side to side, from up going down. Ha? Kasi we are also comparing so make sure that you are percussing at the intercostal space. Ha? Kasi pagka sa buto mo pinarkas, hindi masyadong malakas. No? And you have to depress it deeper. Ha? Pagka nasa area ka na ng liver, there's a transition from resonant to dullness. Hindi to, yung iba nire-report nila dito from the second intercostal space up to nagiging dull because of the silhouette of the heart. Pero usually, saan ba yun? Nabasa niyo ba sa libro yun na ganun ang percussion finding na once in the second intercostal space on the left, it becomes dull?
Sa YouTube parang may nagsasabi.
Ganon. Most of the time kasi you still appreciate resonant pa rin. Resonant kasi naman ang heart medyo medial eh. So pagka nandito ka sa left mid-clavicular line, more of resonant pa rin yan. So ganon ha. So kailangan may sound ka ma-produce ha. Mga babae, i-cut nyo yung nails nyo kasi masakit pagka tinamaan ng kuko. Ha? Then you also do it at the back. So ganun rin. So in the mid scapular area. Ha? Ganun ha. Then you report it as percussion, resonant all over, except at the area of the right side where it became dull at the area of the liver. Ganun mo lang yung report siya. Then you do your auscultation. So for your auscultation, may auscultation rin yun ha. Ang egophony is also for auscultation. Ha? Okay, so make sure that you are using the diaphragm. So all breath sounds are high frequency sounds. So we don't use your diaphragm for your chest and lungs. So put on your, then start at the apex. Okay. Pagka chest and lungs, kailangan sasabihin mo hingang malalim. Hingang malalim. Okay. So you have to finish one cycle, ha? Inhale, exhale. Okay. Yung iba, mabilis, ha? So kailangan it has to be inhale, exhale. Inhale, exhale. So in such a way na you are already comparing both sides. Kasi gumagalaw ka from one side to the other. So pag na-report nyo, you also do the posterior side. Okay, hinga malalim. So make sure you are finishing one cycle. Inhale, exhale. Then go from one side to the other, from apex going to the base. Okay. Pagka nasa base ka na, you go more lateral. So doon sa pakinig nyo na gano'n, naririnig nyo na rin yung mga adventitious sounds kung mayroon. After nasasabihin nyo ang report nyo, clear, vesicular breath sounds all over. No rals, no wheezes, no ronkai. No friction rap. Kasi maririnig mo na dun sa mga yun. Now you do your vocal fremitus. Tres, tres.
Tres, tres.
Tres, tres.
Tres, tres. Tres, tres. Tres, tres. Tres, tres. Tres, tres. Tres, tres. Tres, tres. Tres, tres. Tres, tres. Tres, tres. Tres, tres.
Then, nandito ka na rin sa posterior side, gawin mo na rin yung egophony and bronchophony. Same E. Parang iyon narinig ko doon Yung sinabi mo, no? Sabi ko, ba't parang iyon narinig ko? Iba sinabi mo? Dito?
Tinrolong niya daw.
Trinelong mo lang. Parang sabi ko, parang iyon narinig ko.
Basta may pa siya
So, posterior chest, then you go to the anterior chest. Again, gawin nyo yung tres-tres.
Tres, tres. Tres, tres. Tres, tres. Tres, tres. Tres, tres. Tres, tres. Tres, tres.
Okay, E.
E.
So, yun. Tsaka nyo i-report na equal vocal fremitus, negative egophony, negative bronchophony, negative, yung whispered pectoriloquy, hindi naman, sasabihin mo na lang na sabihin nila na sa bagay hindi naman kasama sa practical sa checklist yung whispered pectoriloquy.
Yun na.
Meron ba?
Meron.
Wala
13 minutes.
Okay, so that's it for the, basta make sure anterior and posterior you can go from one side to the other, but always start on your right side. Then after that, saka ka gumalaw-galaw on the okay, review lang natin cardiovascular kasi it's already